Locals are worried about the future of St. Elizabeth's.
You have lesser options to just get a medical consultation or even an appointment. Of course, it's a bad thing.
St. E's, one of 4 hospitals Stewart Healthcare is now looking to sell off quickly.
Neshoba, Holy Family, Norwood, and St. Elizabeth's. Those are the 4 that they described as urgent cases that need to be moved quickly.
Congressman Stephen Lynch says state officials were blindsided by the bombshell and are now scrambling to keep Stewart hospitals open. Stewart management downplayed reports of closures in an email to employees obtained by News Center 5. Stewart saying, "We are working closely with state regulators and are making progress every day to assure the financial health of our hospitals. Also, we have not asked the state and currently do not believe we need any form of government bailout."
They expressed their intent to exit the Massachusetts healthcare market. They own 9 hospitals. How do you spin that in a good way?
It's never good when a hospital is saying that it's on the brink of failure.
The governor and her team keeping a close eye, and so are other hospital systems that are already on patient overload.
There is capacity crisis at all of our healthcare systems. And so I think it's just most important that we maintain patient first, that patients know that they're going to continue to get care.
And breaking at this hour, we are just confirming that the president of Holy Family Hospital has stepped down to take another job. Also breaking, Mass General Brigham has just confirmed to us that a small group of their physicians who perform surgeries at Holy Family Hospital will no longer do so after hearing the surgical equipment they need may not be available. It is a rapidly changing situation here.